Welcome to the Genie Journal Recap, your monthly update on the regulatory, financial, and operational shifts shaping medical transportation. We track the headlines so you don't have to, and explain what they mean for providers, brokers, and healthcare stakeholders. Here is what mattered in April. The biggest development this month takes the Minnesota Medicaid fraud story we have been tracking and extends it to all 50 states. According to Fox News, CMS Administrator Mehmet Oz sent letters to all 50 governors directing immediate action on Medicaid fraud. States have 10 business days to commit to a swift revalidation of high-risk Medicaid providers and a proposed timetable, plus 30 days to submit a broader 2-year revalidation strategy. NEMT is among the provider categories that have driven this mandate. What started as a Minnesota story is now a national compliance reset. As non-compliant competitors get pushed out through revalidation, capacity opens up for providers who can demonstrate documentation, GPS verification, and clean billing. The bar is rising fast, and quality providers are positioned to absorb the volume. The 2 states leading the enforcement wave are now showing what implementation looks like in practice. Per Beckers, CMS approved Minnesota's revised corrective action plan in a March 19th letter. The state had already hit early milestones for February and March, with a May 31st deadline ahead for off-cycle revalidation of high-risk provider types. However, the approval did not unlock the nearly $244 million in frozen Medicaid funds. On April 6th, a federal judge denied Minnesota's request to release them, leaving the money withheld as the case continues. The first real consequences for providers are arriving. Per Fox 9, Minnesota's revalidation drive, called Minnesota Revalidate, covers nearly 6,000 providers across 13 high-risk programs with a May 31st deadline. So far, 550 have been re-enrolled, and roughly 990 non-responsive billers face disenrollment, clearing the field for providers who stay on top of state notices. Colorado is running a parallel playbook. The state's CMS-approved enrollment moratorium, in place since October 2023, has blocked over 600 suspected entities and prevented more than $24 million in improper payments. The moratorium has been extended through September 30, 2026. For compliant providers, the message is the same in both states. Stay on top of revalidation notices, the appeal windows close fast, and watch enforcement-heavy markets for trip volume openings as non-compliant competitors exit. While enforcement accelerates, not every fraud claim is holding up. CMS issued a public correction this month, and providers should take note. According to a PBS NewsHour AP report, CMS publicly acknowledged that Administrator Oz's claim that 5 million New Yorkers used personal services was wildly incorrect. The actual number was approximately 450,000, or 6 to 7% of enrollees. Governor Hochul's office responded by pointing to the actual figures. For NEMT providers in scrutinized states, this is a useful counterweight. Compliant providers have legitimate grounds to push back when accusations don't line up with the data, and clean documentation is the basis for that advocacy. Back to Colorado, where alongside the enforcement push, a major broker restructuring is taking shape. Per Colorado HCPF Provider News, the state is moving to a single statewide broker, MediDrive, with phased implementation starting July 1, 2026. The current hybrid model uses TransDev for 9 metro counties and local providers for 55 other counties. An operational memo went out March 27th, and a virtual stakeholder webinar follows May 14th from 10 a.m. to noon, where MediDrive will demo its scheduling system live. Once the transition is complete, all providers will work in a single coordinated system, with transportation arranged through the broker rather than directly. Combined with Georgia's move to Verita and Florida's United Healthcare switch to MTM Health, this is the third major state-level consolidation of 2026. Colorado providers have a 2.5-month runway to credential with MediDrive. Move fast and treat consolidation as an opening rather than a disruption. Now to the rate story we covered last month, which had a very different ending than the headlines suggested. According to CMS, on April 6th, the agency finalized a 2.48% net payment increase for Medicare Advantage plans in CY 2027, worth over $13 billion in additional payments. That's a meaningful jump from the 0.09% proposed in January and flagged in last month's recap.
The reversal followed a record 47,000 comments and sustained pressure from AHIP, Better Medicare Alliance, and the Alliance of Community Health Plans.
This is industry advocacy working as designed.
The higher rate eases pressure on MA plans and may slow the erosion of transportation as a supplemental benefit.
For NEMT providers on Medicare Ad contracts, stability after a flat proposal is a real win. Staying with federal policy, the other major story is now hitting state-level implementation. Per CBS News, Indiana Governor Braun signed a 3-month work requirement into law on March 4th, and Idaho followed on April 10th with the strictest version allowed. As KFF reports, Nebraska is moving fastest, implementing early via a state plan amendment starting May 1st. CBO estimates 18.5 million adults will be subject to the new rules across 42 states and D.C. when the federal mandate takes effect January 2027. States are still waiting for final CMS guidance, expected June 1st. Enrollment shifts will likely create volume volatility through 2027. Providers with a diversified payer mix, managed Medicaid, Medicare Advantage, dual eligible, facility, and private pay are built to absorb that fluctuation. Nebraska's May starts will be the first concrete signal. Stepping back from policy, 2 quick signals on the fleet side. Per Kia Media, Kia and BraunAbility unveiled the PV5 WAV concept at the New York International Auto Show on April 1st. It's designed as the first PV5-based ADA-compliant electric wheelchair-accessible taxi and rideshare vehicle in the U.S. A factory-built electric WAV is rare, and it points to fleet expansion without the cost and lead time of aftermarket conversions. Alongside electric vehicles, there's a rapid development of automotive autonomy. RouteGenie CEO Cameron Craig and Marketing Director Yuri Martinov co-authored a thought piece this month on what AVs actually mean for medical transportation. The short version, AVs are moving fast in passenger transport, but the trips where NEMT margins lie, wheelchair securement, stretcher, bariatric, door-through-door, stay firmly in the human-driven lane for the next decade. Full piece in the description. Back to the corporate side, one more model worth flagging. Per Oracle's announcement, Saline Area Social Service, with Oracle's support, launched a senior transportation program in Saline, Michigan on March 25th. The nonprofit purchased a handicapped accessible van targeting 30 rides per week, picking up seniors at home for essential errands and appointments. Rollout is phased, starting with the food pantry and expanding to the Saline Area Senior Center and University of Michigan health facilities in Ann Arbor. Corporate-funded, nonprofit-operated senior transportation is a growing adjacent channel. Providers with ADA-compliant fleets are positioned to contract with local nonprofits and corporate programs alongside their broker book.
Finally, we are back inside the lamp. First, a milestone worth sharing. Over 50,000 medical appointment trips a day are now executed on the RouteGenie platform across the US and Canada. Dialysis, specialist visits, mental health appointments, the trips that genuinely matter, thanks to the transportation providers who trust us to help them deliver access to care. This month, Inside the Lamp features Cameron Craig, RouteGenie's new CEO, in his first podcast appearance. The conversation covers his background, the family story that drew him to NEMT, RouteGenie's first-to-market Uber Health partnership, and what is on his 90-day focus list. This is it for this month's Genie Journal recap. The compliance bar is rising, advocacy is working, and compliant providers are positioned to take share. For deeper analysis and source links, check out the description. If you found this useful, give us a like and subscribe so you don't miss the upcoming recaps. See you next month.